Safe medication use is important at any age, but it is especially important for older adults who use more prescription and over-the-counter medications than any other age group. The more medications a person takes, the greater chance there is for medication errors, unsafe drug interactions, falls, and motor vehicle accidents. Aging changes the way that medications are absorbed and used in the body, and the response to medication becomes more varied and unpredictable as people grow older. For example, medications may be absorbed or eliminated from the body more slowly because of changes in liver and kidney function. This increases the risk of reactions in older people. Responses to medications can include side effects or adverse reactions. A side effect is a well-known, expected response. For example, the side effect for antihistamines is drowsiness. Severe, long-lasting side effects, or any that interfere with the person's ability to function, should be reported to the nurse or your supervisor. An adverse reaction is any unusual, unexpected response to a medication. An adverse reaction can occur as an allergic reaction to a drug or a combination of drugs. Taking multiple prescription drugs increases the risk of adverse reactions. Over-the-counter medications, caffeine, natural herbal products, and alcohol are also drugs and can cause adverse reactions when combined with prescription drugs. Adverse reactions include difficulty concentrating, forgetfulness or confusion, visual or hearing problems such as blurred or double vision, loss of hearing or ringing in the ears, unusual swelling or rash, fainting or extreme weakness, dizziness, tremors or stiffness, loss of bladder control or difficulty urinating, gastrointestinal problems, including digestive upset, constipation, diarrhea, or vomiting. Some adverse reactions, such as depression, confusion, or forgetfulness, may take weeks and months to develop. Do not assume that depression, fatigue, confusion, or weakness in an elderly person are a natural part of aging. They may be an adverse reaction to medication. If you observe a change in your client's physical condition or behavior,
are you all right?
Describe it in writing so that you can report it accurately to your supervisor. Some foods can lessen or increase the action of a medication. For example, dietary fiber can slow down the absorption of some medicines. Dairy products interfere with the absorption of the antibiotic tetracycline. Before helping anyone with medications, wash your hands thoroughly. Be sure that the client's hands are clean as well. Avoid distractions and make sure there is adequate lighting to lessen the chance of any error. Guidelines for safe medication use are defined in the 5 R's. The right person, the right medication, the right dose, the right time, and the right route of administration. Nurses use these guidelines when administering medications, and some of the guidelines are important for you to follow when assisting someone with medications. Each time you assist with medications, ask yourself, is it the right person? Is it the right time? And is it the right route? The right route means how the medication is to be taken. Is it to be taken by mouth, as an ointment, under the tongue, or is it a patch to be placed on the skin? It is the responsibility of a professional nurse or the family caregiver to set up and administer medications. As a care provider, it is illegal for you to set up and give medications to your client, but the law does allow you to remind and assist with medications. It's important for you to understand what remind and assist really means so that you stay within the law. To assist or remind with medication means specific types of help, such as inquiring whether medications were taken.
Mr. Willis, have you taken your medicine today?
No, I haven't.
Let me get that for you.
Thank you.
Okay.
Reminding the client to take his or her medication.
It's 10 o'clock, Virginia. It's time to do your eye drops.
Okay, I almost forgot.
Handing the appropriately marked medication container to the client. Opening the properly labeled container if the client is unable to physically open it.
Would you like me to help you with that?
Please.
Giving a glass of water. Keep in mind that the medications must be set up by the nurse or family member in a container other than the prescription bottles, such as a medication organizer. This includes prescription medications and over-the-counter drugs. Assisting with medications does not include taking the medications out of the medication organizer. The client must be able to do that for him or herself. Medication organizers must be clearly marked with the day and time of day that the medication should be taken. The client is responsible to take his or her own medications, including eye and ear drops, nasal sprays, or ointment. If he or she is unable, report it to your supervisor so that arrangements can be made. Stay with the person until he or she has taken or applied the medication. Always record when you have assisted with medications and that they have been taken successfully. Report if you observe your client refusing to take medications, taking them at the wrong time, too often, or not enough. Oral medications usually come in pill or capsule form. Pills tend to stick in a mouth that is dry. Offer the person a sip of water before he or she takes the medication. Water is the safest liquid to use with oral medications. Milk and some juices can interfere with absorption. The client must be able to pour his or her own liquid medications, or the nurse or family member are responsible. Sublingual medication is placed under the tongue and left to dissolve there slowly. It is absorbed through the lining of the mouth. Sublingual medications should never be chewed. They should not be swallowed until the tablet has completely dissolved. Medications that are placed on the skin include creams, lotions, ointments, and patches. Patches that contain medication are placed on the skin, where they are absorbed over time. Used needles and syringes or patches need to be disposed of properly. Even used patches may still contain medication that could be absorbed into the skin. Have the client dispose of the patch directly into the trash container. Used needles should be disposed of in a puncture-proof, leak-proof, appropriately marked container. Many of the injuries that occur when using needles happen during disposal. Never recap needles before placing them in the sharps container. They should drop in easily. Never fill the container more than 3/4 full. When the container is 3/4 full, close it. It is designed to lock after closing. Needles or sharp containers should not be placed in ordinary garbage. Some states impose fines for disposing of needles improperly. Follow your agency's policy and procedure for sharps container disposal or your local sanitation company for proper disposal of sharps containers. Keep medication containers tightly closed and store in a cool, dry place unless instructed otherwise. Light, heat, and moisture can spoil or decompose medications. Do not store medications on windowsills, in the bathroom, or near sinks. Some medications may need to be refrigerated. Do not store medications in the refrigerator unless directed. Use a safety lock to keep medications out of reach of children or people with dementia. Medications play a vital role in your client's health and well-being. Assisting with medications is a responsibility that must be taken seriously. As a care provider, you are legally allowed to assist with medications, but you are not permitted to set up or administer medications to your client. Only the nurse or family member can do that. Correctly assisting with medication means providing help to your client while staying within the legal limits of your role as a care provider.